So Betty, here we are about 12 or 13 years past that famous walk with the dog, and mental health first aid is looking at a growing future. How do you feel now, these 12 years on since the start?
Well, I'm amazed. My husband Tony Joe and I got this going. We thought it would just be something we'd run a couple of courses a year, and that's as far as we thought. The fact now that it's gone to 15 countries, it's being written into mental health policies. I don't know, I still keep thinking, well, I don't know how that happened. The instructors is the most exciting thing.
Yes.
It's their enthusiasm. And you heard those three panellists that we just had talk about mental health first aid in different settings. We didn't set them up, we didn't ask them, we didn't even approach them, come and talk at the conference on that. They put that forward.
It does invite people to talk more openly about mental health and mental health issues, which is fantastic.
It is fantastic.
I really believe that there's a role for our whole community to be able to embrace this sort of training.
I do two things. One, I deliver the 14-hour course across Australia in all the streams, but I also train instructors. Some of the national training teams are training Aboriginal instructors.
What's it like being an MHFA instructor?
Well, I'd have to say it's some of the most exciting work I do, Derek, from the point of view that time and time again I hear from people, wow, why wasn't I told this some time ago?
This course saves lives, and it really improves quality of life. It's a preventative as well as an early treatment, and it also prevents reoccurrence of mental illnesses as well.
The staff, we have 6 staff in mental health first aid, and they are just amazing what they achieve. So yes, this program will keep going, it really will.
MHFA has been adopted in 16 countries, going on 17, soon to go to Saudi Arabia, and the 16 countries represent 12% of the world's population, so it's pretty remarkable how quickly it has travelled over 10 years. Recently reached a milestone of having trained 1% of the adult population last year, so that represents 170,000 adults. And we're hoping to reach many more people with the programs that we plan to develop.
It makes sense to put money into this rather than to put money into solving problems after they've happened.
Yeah, absolutely. As you say, prevention is better than a cure.
You know, Derek, you really ought to be on the radio with a voice like that.